One of the major beliefs that I had when even in campus is that psychology is just what we've been taught in school. The Freudian theory, all those theories we learned in school. But after joining Shamiri, I got to be taken through the training, and I got to understand that we can actually do psychology in an African way. My name is Grace Mawe, a clinical supervisor at Shamiri. I completed my university degree in 2022. After that, I worked at a hospital, Kitui County Referral Hospital, as a psychologist. One of my roles was to ensure that patients are well taken care of mentally. So after that, I saw an opportunity and I applied for it. I did an interview, and here I am as a clinical supervisor. I think I've been in peer-led mental health interventions for the longest time. When I went to high school, I was in the peer educators club. I was a peer educator in the university. With that, when I saw what Shamiri was doing, I was very intrigued because it is something that I've been doing, and I was so eager to join in because it is not so common to see that. I provide clinical supervision and ensure a safe, effective, accessible, and also secure implementation of the Shamiri program. The first thing I do is ensure that the fellows are very much aware of the protocol. This is what you're doing, this is the time you're getting here, this is how you talk to a student, this is how you conduct yourself. But at the same time, we also need to understand that these are human beings who have different personalities. You are a mentor before anything else. You're required to inspire them because at times they come in fresh from high school, they know nothing about mental health. Some of the key indicators I look for in fellow performance is number one, discipline. My fellows know very much that I'm always on ground. So I always tell them, if you need anything, I'll always be there in a minute. So be very open to communication, be disciplined, be respectful to your fellow colleagues and also your supervisors. Be very respectful to the clinical leads, to the hub coordinators, and anyone who is above you, below you, and even horizontally is the same. How I handle situations whereby a fellow has encountered a difficult case is the fellow brings a case to me. I identify the risk case. If it is a very high risk case, I have a clinical lead who is very helpful. This is Kiumbi Secondary. Kiumbi is in Machakos County. This is session 2. A few hours ago, we did role plays so that they can just come and give the students the best of the best. We are going to tackle problem solving skills and help the students understand more on what is problem solving and how to go about it in daily lives. So if your student did questionnaires last week, we are a data-driven organization. So we have the data. The data shows that we have really made an impact. Last week, we actually had a very interesting session with one of the schools whereby we were delivering the intervention, and they were giving us first-hand testimonials from the students, from how the behavior has changed, from how the students are so positive, from how they are even having an easy time with the students. The teachers are actually even enjoying to talk to the students, to communicate with them, to interact with them. We have very few cases, if any, of students dropping out of the program. So first of all, the students are very comfortable around the peer educators. They are very comfortable around the fellows because these are people who are very close in age range with them. They open up very easily. Another thing is how the students are accepting the program. Not just are retaining, but they're also very eager to learn from us. They're eager to participate. They're eager to come forward with maybe any mental health concern that they may have. So I think it is a clear indicator that we are really impactful. It is a very effective model. It is for the youth and by the youth. As you can see around, we are a very youthful population. So if you are interested in doing this model or even implementing the model, I would say why not? You should have just started yesterday because it is effective, it is working and it will keep working. Hi, Austin. How's the session?
Really good. I enjoyed it.
Nice, nice. Thank you.